Hi and welcome. My name is LaryssaDomagala and I am a sales representative at Independent Health. I've actually been at Independent Health for 15 years and I want to thank you for the opportunity to get to present to you today. I'm here to review our 2021 individual Medicare Advantage plans, and Independent Health is a Medicare Advantage organization with a Medicare contract, and we offer HMO, SNP, HMO, and PPO plans. Enrollment in Independent Health depends on annual contract renewal. So just some basics, sorry if it's a little duplicative from what you've heard earlier today, but what's required to enroll in a Medicare Advantage plan? You must have both Part A and Part B of Original Medicare to be eligible. You must continue to pay your Medicare Part B premium, even if the health plan premium is zero. And you must live within the Independent Health Service area, which is the 8 counties of Western New York, and cannot temporarily reside outside of the service area for 6 consecutive months. When can I enroll or change plans? So this is probably why everyone is here today. The annual election period is October 15th to December 7th. This is truly an individual's only annual opportunity to enroll or change plans for a January 1st effective date. If you're comfortable with your plan, you don't have to do anything. You will automatically be renewed in your plan. Sometimes some individuals have special enrollment periods that make them eligible for special enrollment periods that may be able to make changes during the year outside of the annual enrollment period. So for example, if you moved in or out of the plan service area. If you think a special enrollment period applies, we encourage you to speak with one of the red shirts that we have at Independent Health. So Independent Health, Medicare Advantage, HMO, and PPO plans, we have with and without prescription drug coverage. And also a note, this is not a complete description of our information, but you can contact us for more information. And our phone number is below. Our 1-800 number is 1-800-958-4405. TTY users dial 711, and our hours of operation are below. So what is a Medicare Advantage plan? A Medicare Advantage plans are offered by private insurance companies such as Independent Health. Medicare Advantage plans must at least cover all of the services that our Original Medicare covers, except for hospice. Original Medicare covers hospice care even if you are in a Medicare Advantage plan. So what this is saying is that if it's covered under Original Medicare, Medicare Advantage plans need to cover it with the exception of hospice. What is a Medicare Advantage plan? When you go to the doctor or hospital, you would only show your Independent Health card. Independent Health is responsible for your claims. You simply pay your copay and coinsurance at the time of service if one applies. So what is an HMO plan? HMO stands for Health Maintenance Organization. This means that you must use doctors or providers that are part of the Independent Health Network. You must choose a primary care doctor who is in the Independent Health Network, but on our program, no referrals are required. And you must receive all of your routine care from Independent Health providers. But don't worry, in case of an emergency or urgent care situation, you are covered worldwide. What is a PPO plan? PPO stands for Preferred Provider Organization. This gives you the choice to see doctors, hospitals, and providers outside of the Independent Health Network. But your cost share may be higher for services you receive outside of the network and may be subject to co-insurance, which is a percentage of the bill. Some plans have special networks, and if you have questions around special networks, just speak with Independent Health, a red shirt today. You have worldwide coverage for emergencies and urgent care. This includes ambulance service. Emergency coverage is limited to $10,000 per occurrence for unforeseen care outside of the United States. Our 2021 plan overview. We're always looking for ways to provide more value in our plans while continuing to give you the benefits and services that you use the most. In 2021, Independent Health offers a variety of Medicare Advantage plans to help you meet your needs. We have plans ranging from a $0 monthly premium to $215 per month. Our Medicare Sales Kit offers a description of all of our available plans, and the contact information provided to you previously or later, you could request a full sales kit if you are interested. Some features of independent health. You are covered worldwide for emergency and urgent care. No matter where you travel, you'll benefit from urgent care covered at urgent care centers or walk-in clinics, in addition to our global emergency room care. There is, for worldwide coverage, a maximum plan benefit limit of $10,000 per occurrence for unforeseen care outside of the U.S. and its territories. All of our plans include preventive services. Staying up to date with your preventive care is key to maintaining and improving your health and well-being. Get more with Independent Health, our premier wellness package. At Independent Health, we want to give our members a chance to get most out of their health benefits. We know that helping you maintain a healthy lifestyle, including ways that go above and beyond Medicare coverage. We're always looking for ways to enhance our benefits. That's why we developed our wellness package of benefits and services that's now included with all of our individual Medicare Advantage plans we offer. There is an exception, is not available on our institutional special needs plan. Our premier wellness package includes vision coverage, so it covers routine eye exam and an eyewear allowance. Preventive dental includes routine dental cleanings, exams, and x-rays. A gym membership. We're now partnering with Silver Sneakers to offer enhanced access to gyms most convenient to you. Hearing aid benefit, coverage for evaluations, fitting, and hearing aid purchases. An enhanced annual well visit is a comprehensive annual wellness visit with your doctor that includes a detailed exam and conversation about your health to create a personalized care plan. Telemedicine benefit to get you the care you need when you can't reach your primary care physician. And Brooke, it's a smartphone app that provides 24/7 health coaching, helping you make daily health decisions and provides support for chronic conditions like diabetes and hypertension. It is important to note that you must use network providers for these benefits that I reviewed above. We have a telemedicine benefit through Teladoc. This service will get you the care you need when you can't reach your primary care physician. You can speak by phone to a U.S. doctor anytime, anywhere for common medical issues, such as a cold, flu symptoms, bronchitis, allergies, poison ivy, pink eye, sinus problems, ear infection, or more. Don't those all sound like fun? Consultations can be made 24/7 by calling 1-800-TELEDOC. A copay will be charged based on the benefit of your plan, and Teladoc can also be accessed via smartphone or tablet through the app. You will have access to a doctor from your home state from most places in the world, including cruise ships. It's available anywhere in the world where there is internet access. Supplemental comprehensive dental benefits are now available on select plans. For a $25 monthly premium, in addition to your monthly plan premium, you can get comprehensive dental coverage through HealthPlex with no annual deductible. You would pay 50% co-insurance for covered services. The services that are available to you with this benefit include restorative, endodontics, periodontics, and more. You must use a HealthPlex dental provider to get the services covered with this benefit. For a list of HealthPlex dental providers, you can visit independenthealth.com/Medicare to utilize the Find a Medicare Provider section. Supplemental comprehensive dental includes a maximum annual allowance of $3,000. On the first of each quarter, so January 1st, April 1st, July 1st, and October 1st, you accrue an additional $750 of the comprehensive dental benefit. Any unused balances will carry over from quarter to quarter. Coverage is based on the available balance on that date of service. Any unused balances will expire on December 31st. Speak with a redshirt today to learn if your plan is eligible to add this benefit or for any enrollment information. We do have some enhanced benefits on select programs with Independent Health. Select plans include additional benefits because helping you get and stay healthy is our top priority. We have non-emergency transportation to plan-approved medical locations covered on our Encompass 65 Core, Basic, and No Prescription plan, as well as our Assure Advantage HMO C-SNP plan. A little bit more on that program coming up in a moment. And also, we have home-delivered meals available after a hospital or skilled nursing facility overnight stay, covered on Encompass 65 Basic, Encompass 65 NORAX, and our Assure Advantage C-SNP plan, HMO C-SNP plan. So a little bit more about the Independent Health Assure Advantage HMO C-SNP plan. At Independent Health, we're dedicated to helping our members live healthier lives. We have developed a Medicare Advantage plan specifically designed for people with Medicare who have been diagnosed with diabetes and chronic heart failure and who reside in Erie County. This plan has benefits specifically designed to help find ways to get and stay healthy with the assistance of a care manager. If you want to learn more, you can always speak with a red shirt. So Medicare Part D, which is the outpatient prescription drug coverage. What is a formulary or a drug list? It very simply is a list of prescription drugs that a health plan covers. Each health plan offers its own approved formulary based upon federal guidelines. All drugs are listed with a tier 1 through 5 after the name. This will determine what your copayment or cost share is for the medication based upon the plan that you enroll in. The one exception is that our Independent Health Assure Advantage program has 6 tiers. All of the formularies are available as well as online at independenthealth.com/Medicare, or you could also call us and we'd be happy to mail you one. So how do you use your prescription drug benefit? So this is the Medicare Part D benefit, so it has several phases of coverage. In the initial coverage phase, you pay your copayment or coinsurance based on the tier your medication is until you reach your initial coverage limit, so tier 1 through 5. Some of our programs have what's called a deductible. So that means if you are taking a medication that's listed on a tier 3, a tier 4, or a tier 5, you may have to pay the full amount of your medication before you're eligible to pay copays. The copays are different based on which program you're on, as well as the deductible differs based on which program you're on. And for a list of the deductibles based on the plan, please review the screen in front of you. Our Passport Prime PPO, our Family Choice I-SNP, and the Assure Advantage HMO C-SNP plan has no deductible. Now that you're past the deductible phase, you're in the initial coverage. So what happens on all plans when the total cost of your medication, meaning what you pay and what Independent Health has paid combined, reaches a total of $4,130, you will then move into what's called the coverage gap, or sometimes referred to as the donut hole. This amount includes your deductible, copayment or coinsurance, and what Independent Health has paid towards your medication. And a deductible, again, only if it's applicable based on your medication or plan. So now you're in the coverage gap or the donut hole. You would pay 25% of the negotiated rate for generic and brand name medications in the coverage gap. You would pay this discounted rate on your medication until your total or your true out-of-pocket costs reach $6,550. This includes any money spent on deductibles, copays, or coinsurance, as well as out-of-pocket costs in the coverage gap, including the 75% subsidy from the drug manufacturers for brand name medications. Our one program, Passport Prime PPO, has no copay for tier 1 medications covered through the coverage gap. How do you reach catastrophic coverage, and what does that mean to me? So again, once you or someone on your behalf has paid $6,550 out of pocket for your medications in a calendar year, you have reached the out-of-pocket maximum level and are now in catastrophic coverage. After reaching this level, you will pay either a small coinsurance or copayment, the greater amount of either 5% of the cost of the drug, or $3.70 for generics, or $9.20 for your brand medications for the rest of the calendar year. New benefits for 2021, Independent Health now offers lower copay for insulin. Independent Health recognizes the cost of insulin can be overwhelming. In order to help our members with diabetes that require the use of insulin to help manage their condition, Independent Health is proud to offer the Part D Senior Savings Model. This enhanced coverage is available on all of our individual Medicare plans with prescription drug coverage, with the exception of our institutional special needs program. So this provides a low $35 copay for insulin all year long, including in the deductible, initial coverage, or the coverage gap phases of your prescription drug benefit. And on separate enhanced benefit on our Assure Advantage program, the chronic special needs plan, the copay for insulin is $11. All of the insulins covered on our formulary are included in the program. Some brand names you may recognize are Humulin and Humalog, Levemir and Tresiba, Lantus, Toujeo, and Soliqua. What are network pharmacies? Independent Health has contracts with more than 59,000 pharmacies nationwide. You normally need to use network pharmacies to fill your prescription, except in emergency situations. Utilization management. Some medications may have additional requirements or limits on coverage. The formulary would identify if the medication you are taking has any limits or restrictions. Please refer to our formulary for more information on any prior authorization or step therapy that may be required. The Part D late enrollment penalty. If you did not take Medicare Part D, take a Medicare Part D plan when you were first eligible, and you don't have other creditable prescription coverage, that's coverage as good or better than the Part D benefit, you may be charged a Part D late enrollment penalty if you do not pick up Part D in the future. So we'd like to offer you the chance to experience our red shirt treatment, our 2021 enrollment and plan review. If you are a current Independent Health member and want to stay in your current plan, you don't need to take any action. Your plan will automatically renew for the next year. We make it easy if you decide you want to enroll in Independent Health, or if you are already a member and wish to switch your current plan. You can do this over the telephone, at a Medicare Information Center, which we have set up locally in the community. You can review information online at www.independenthealth.com/Medicare2021. You could also review the Medicare.gov site at www.medicare.gov for plans that are in your area. You can mail in your application or talk to us right now, one-on-one after the program. Stars matter. Star ratings are compiled annually by Medicare and are an unbiased way to compare Medicare Advantage plans based on quality, value, and performance. Stars show how well the plan performs cumulatively on a set of quality measures designed to help you objectively choose a plan. Every year, Medicare evaluates plans based on a 5-star rating system. Plan performance star ratings are assessed each year and may change from one year to the next. A copy of Independent Health Star Ratings is included in our sales kit, as well as online at our website, www.independenthealth.com/Medicare2021. The red shirt treatment. As a true local health plan based in Western New York, it has been our privilege to call this our home for 40 years. We recognize that healthcare is complicated and personal. Our red shirts are here to help you. After you enroll, we have year-round local customer service. It's part of the reason why more people choose us than any other Medicare Advantage plan in Western New York, and that's per CMS Western New York enrollment dated from August of 2020. For further information or questions or for other accommodations, please contact Independent Health Medicare Sales Department, and our toll-free number is 1-800-958-4405. TTY users, please dial 711, and our hours of operation are from October 1st to December 7th from 8 a.m. to 8 p.m., Monday through Sunday, and December 8th through September 30th, 8 a.m. to 8 p.m., Monday through Friday. I want to thank you for your time and look forward to speaking with you in the future. Take care.